Hey guys, this is Dr. Hub. Today we are going to look at the Lepra reactions. So under Lepra reaction, we'll be looking at the type 1 as well as type 2. So first we are beginning with the type 1. The type 1 is nothing but the reversal or upgrading. And where is it seen? It is seen mainly in the borderline spectrum. So there is a borderline spectrum. So what does this include? Borderline spectrum, it includes the BT, BB as well as the BL. So the most severe form is the most severe form is the borderline leprosy. It is the borderline leprosy. So borderline leprosy in short is known as the BL. Next, it is usually seen within 12 months. It is usually seen. This is within 12 months. It is usually seen within 12 months. And this is of the initiation of the multi-drug therapy. This is with the initiation of the multi-drug therapy. Next, we will move on to the hypersensitivity. So it is nothing but the type 4 hypersensitivity. And this is due to the enhanced cell-mediated response. This is due to the enhanced cell-mediated response. And this increases the destruction of the bacilli. This increases the destruction. This is destruction of the bacilli following the treatment in reversal. Following the treatment in the reversal. Next is we look at there is inflammation. There is inflammation. And this inflammation is of the existing skin lesions. Of the existing skin lesions. And how are the skin conditions? It is red. Then it is painful as well. It is painful. Next, there is edematous skin lesions as well. Edematous skin lesions. So what happens here is that they may ulcerate. So these skin lesions, they may ulcerate. So it ulcerates. And now we have the new skin lesions. New lesions, there is the new lesions. So the new lesions, it may occur. And this is rare. Next, what we have is the neuritis. It is the neuritis, and then we have the nerve abscess. So this is nothing but it is red, and there is a painful inflamed nerves. There is a painful as well as there is inflamed nerves. So what about the systemic involvement? So when you look at the systemic involvement, the answer is no, there is no systemic involvement. Next, we'll look at the treatment aspect. So in terms of treatment, the type 1 of the Lepra reaction, we give the supportive therapy. There is supportive therapy which can be administered, and this is nothing but for the mild reactions of the NSAIDs. This is with the mild reactions with the NSAIDs. Next is in case of severe reactions. So in case of severe reactions. So in terms of severe reactions, and this is with neuritis and eye lesions. So here what we administer is the oral corticosteroids. Next, we move on to the drug of choice. This is the drug of choice. Then when we look at the nerve abscess, here there is a additional surgical drainage. There is a additional surgical drainage. Then what are the other drugs which are present? The other drugs which are present are the there is clofazamine, as well as the cyclosporin, there is cyclosporin. Now we spoke about the type 1 reaction. Now we'll move on to the type 2. So type 2 reaction is nothing but there is a erythema nodosum. There is erythema nodosum, and this is leprosum. So this is mainly seen in case of the LL, that is a lepromatous leprosy. So this amounts to about 50% and it is greater than that of the BL, which is 15%. So it is unrelated. It is unrelated to the multi-drug therapy. Unrelated to the multi-drug therapy, and it may occur before and during or after the treatment. It occurs before, during or after. Before, during or after the treatment. Next, we are moving on to the hypersensitivity. So what hypersensitivity is it? It is the type 3 hypersensitivity reaction. So it is a type 3 hypersensitivity. It is primarily humoral. It is primarily humoral, and there is a immune complex deposition. There is a immune complex deposition. So this is present in the tissues and the vessels. This is in the tissue and the vessels. Next is the cytokine involved. So the cytokine involved here is nothing but the TNF alpha. It is a TNF alpha. So what are the other features? It is a new, it is erythematous, as well as it is tender. It is subcutaneous and dermal nodules. It is subcutaneous and dermal nodules. So they are widely distributed over the extremities and the face. They are distributed over the extremities as well as the face. The existing lesions do not change. The existing lesions, they do not change. They do not change. Next, we move on to if the systemic symptoms are present or not. So when you are looking at the systemic symptoms, so the systemic symptoms, they are present. It is present. So it is present, but what are they? They are, it includes fever, it includes myalgias, next it includes the arthralgias, then there is also the anorexia, the keratitis, iritis, nephritis, then comes the synovitis, next there is also the orchitis, then lymphadenopathy. Now, what is the treatment of this? The treatment is, there is a oral corticosteroids. Treatment is the oral CS, that is the corticosteroid. It is nothing but the first line drug. Next comes, there is a clofazamine. There is clofazamine. So clofazamine is nothing but a steroid dependent ENL. It is a steroid dependent ENL. Then comes the thalidomide. So let's discuss about the thalidomide. So thalidomide is special because it is the most effective. So you might think it is most effective, so it is used everywhere. So let's talk about thalidomide. We told it is most effective, but it is not used everywhere because of its side effects. So it is, side effects are prominent. Because of that reason, it is not used much, not used first because of the side effects. So this was about comparing the type 1 Lepra reaction and the type 2 Lepra reaction. To learn and grow daily like this, please do subscribe.